Hello everyone, I'm Dr. Amit. Before we dive into today's IELTS season, please take a moment to subscribe to my YouTube channel and hit the bell icon so you never miss an update from our medical series. Today I'm excited to kick off our very first video in the respiratory system series. We are going to master the development of lung embryology and anatomy. I'll be using these detailed diagrams and notes to help you visualize the complex transition from a simple bird to a functional respiratory organ. This topic is absolutely essential whether you are preparing for MBBS professional exams, preparing for entrance test, or tackling USMLE. The examiner loves these developmental milestones. So let's start our topic, lung development. Lung development occur in five distinct stages: embryonic, pseudoglandular, canalicular, saccular, and alveolar. It all begins in the fourth week of development, which outpouches from the foregut. Let's talk about the first stage of lung development, that is embryonic stage. It start from the fourth week to seventh week. In this stage, the lung board undergoes initial branching to form trachea, bronchial buds, mainstem bronchi, secondary bronchi, tertiary bronchi, which is also called as segmental bronchi. We can see in this picture that this is foregut and this is respiratory diverticulum. Now this respiratory diverticulum forms long bird, and this long bird in the upper part it forms trachea. Then it divide into bronchial bird, and then this trachea, you can see here is the primary bronchi, then it develop into primary bronchi, then secondary bronchi, then tertiary bronchi. From clinical point of view, if any error occur in this stage, that's embryonic stage, then tracheoesophageal fistula occur in the patient. Now we'll talk about the second stage, that is pseudoglandular. It start in the fifth week of development and till 17th week of development. In this stage, endodermal tubules form, then terminal bronchioles, which is surrounded by modest capillary network. But the infant respiration is not possible in this stage. They are incompatible with life. So when we look in this diagram, so till tertiary bronchi, it form in the embryonic stage, but in pseudoglandular stage, these bronchioles, okay, these terminal bronchioles form. Now we'll talk about the third stage, that is canalicular stage. It start from 16 week to 25 week. This stage is the bridge to viability. Terminal bronchioles, in this stage, terminal bronchioles divide to form respiratory bronchioles and alveolar duct, and these ducts are surrounded by capillary network. If you'll see from clinical significance, okay, pneumocytes develop at 20 weeks because this stage occur from 16 to 25 weeks. So at 20 weeks, pneumocytes develop and respirations capable at 25 weeks. That's why we also call that this is a bridge to viability. Now we can correlate from the diagram, okay. In the embryonic stage, primary bronchi, tertiary bronchi, primary bronchi, secondary bronchi, and tertiary bronchi form. In the pseudoglandular stage, bronchioles, okay, terminal bronchioles form, and in the canalicular stage, they form the respiratory bronchioles and alveolar ducts, okay. And also don't forget that pneumocyte starts developing in the canalicular stage, and the infant respiration starts in this stage, okay. Now we'll look in the fourth stage, that is saccular stage, okay. So in this stage, it starts from the 24th week of development to birth. In this stage, alveolar ducts form and terminal sacs form, and then terminal sacs separated by the septae. Now we'll look in the final stage, that is alveolar stage. It starts around 36 weeks and till 8 years of age. In this stage, terminal sacs form, then the alveoli converted into adult alveoli, okay. Now let's talk a little bit about physiology at birth, okay. So in uterus, okay, breathing occur by aspiration and expulsion of amniotic fluid, okay, and there will be increase more pulmonary vascular resistance throughout the gestational period. But the moment, okay, but the moment the baby takes the first breath of air, fluid is replaced by oxygen, okay, and the pulmonary vascular resistance decreases. So throughout the gestation the pulmonary vascular resistance is more, but once the air replaces the fluid, it decreases the pulmonary vascular resistance. Now let's talk about lung clinical anatomy, okay. We all know we have right lung and left lung, okay. So we have right lung, in which there is three lobes, okay, right upper lobe, right middle lobe, and right lower lobe, okay. But when you look in the left lungs, it has only two lobes, that is left upper lobe and left lower lobe, okay. So a classic exam question involves foreign body aspirations, okay. So always remember the right mainstem bronchus is wider, shorter, and more vertical than the left, okay. So make it the highway for inhaled objects like peanuts. So that's why it's written that right lung more common site for inhaled foreign bodies, because right mainstem bronchus is wider, more vertical, and shorter than left, okay. So if you aspirate a peanuts, okay, so if the patient is in supine position, okay, means if the patient is lying down, then the object usually enters the superior segment of the right lower lobe. Sorry, so it was a mistake, okay. So if the patient lie in supine position, so the object usually enter in the superior segment of the right lower lobe, okay. But if the patient is lying on the right side, okay, so it usually enters in the right upper lobe. But if the patient is in upright position, then the peanut or the foreign body will enter in the right lower lobe, okay. Now we'll see the figure. So this is not a good diagram, but just let's assume, okay. So this is right lung and this is left lung, okay. So right lung is right upper lobe, right middle lobe, and right lower lobe, and this is the left lung, that is left upper lobe and left lower lobe, okay. So if the patient is in supine position, then the foreign bodies will enter into the right lower lobe, okay. If the patient is lying on the right side, then it will enter the right upper lobe. But if the patient is in upright position, then it usually enters the right lower lobe, okay. So I hope this breakdown make these concepts clear and easy to recall for your exams, okay. If you find this video helpful, please subscribe to my YouTube channel, give this video a thumbs up, and share it with your colleagues and friends. So keep studying hard, and I'll see you in the next video of the respiratory series. Thank you.